Spina bifida literally means split spine. A fault in the development of the spinal cord and surrounding bones, vertebrae, can leave a gap or split in the spine. The spinal cord does not form properly and may also be damaged. Diagnosis of spina bifida requires the systematic examination of each neural arch, from the cervical to the sacral region, both transversely and longitudinally. In the transverse scan, the normal neural arch appears as a closed circle with an intact skin covering, whereas in spina bifida the arch is U-shaped and there is an associated bulging meningocele, thin-walled cyst, or myelomeningocele. The extent of the defect and any associated kyphoscoliosis are best assessed in digital scan. The site of open spina bifida are 1. Lumbosacral, 65%. 2. Sacral, 24%. 3. Thoracolumbar, 10%. 4. Sacral, 24%. 5. Thoracolumbar, 10%. 6. Cervical, 1%. Open spina bifida is associated with the Arnold-Chiari II malformation, with caudal displacement of the brain stem and obliteration of the cisterna magna. At 11 to 13 weeks gestation, in the mid-sagittal view of the head, the lower part of the brain between the sphenoid bone anteriorly and the occipital bone posteriorly can be divided into the brain stem in the front and a combination of the fourth ventricle and cisterna magna in the back. In most cases of open spina bifida, the diameter of the brain stem is increased, the distance between the brain stem and the occipital bone is decreased, and the ratio of the brain stem to occipital bone is greater than 1.0. In the second trimester, more than 95% of fetuses have frontal bone scalloping, lemon sign, and obliteration of the cisterna magna, with either an absent cerebellum or abnormal anterior curvature of the cerebellar hemispheres, banana sign. A variable degree of ventricular enlargement is present in virtually all cases of open spina bifida at birth, but in only about 70% of cases in the mid-trimester. Supplementation of the maternal diet with folate, 5 mg day, for 3 months before and 2 months after conception, reduces the risk of recurrence by about 75%. Thanks for watching. Please subscribe for more.